Hi, all. Thanks so much for watching. Speaking of Making Healthcare Work for You, I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we are welcoming back our guest, Mike Critelli, who is the co-founder of the MakeUsWell Network. We've talked to Mike a couple of times. I talked to him for Founders Mission, and then we also talked to him for Making Healthcare Work for You a few weeks ago about his COVID-19 work specific to the deaths and the hospitalizations related to nursing homes and long-term care facilities. But today we wanted to talk to Mike again because his team has been doing really great work around the communication and the data and trying to keep up with everything, especially as the vaccines are now becoming available. So Mike, why don't you start by telling us what's the latest work that you're doing and what's the most important work that you're doing right now?
Thank you very much, Stephanie. And I really are focused on the subject of vaccine trust, because to get herd immunity, we need a large part of the population to trust the fact that the vaccines are going to work for them. There are many distrustful population segments. We are identifying those segments. Rose Teresa, my CTO, and the team that we have put together is understanding that we need to look at population segments, customized messages, and customized channels, and we need to rapidly adapt to what we are seeing in the news. So as the Johnson & Johnson vaccine gets approved, there are comments about it. As other vaccines have stories about side effects, the messages, the channels, and the population segments evolve. And we're in the process of developing and rolling out analytics that'll help decision makers and influencers do a better job in this fast changing environment.
Is having that data the most important thing to helping build trust, or is there some other key component to building that trust?
Well, there are multiple factors that build trust. It's, do you trust the authorities? Do you trust credible data? Do you have people that are like you delivering the data? So Black audiences tend to approach this with more trust if there's a Black physician who understands their unique needs. And it's also the ability for them to ask questions and get answers to their deepest concerns. And although it's good to have celebrities and one-way messaging, interactivity and people close to you is equally important. And the ability to react dynamically as news comes out and as messages need to reflect that news.
And I would presume, Mike, it's such an interesting thing you're pointing out. One thing that it brings up, which we discussed in our last conversation, is resolving controversies. There's so much conflicting data. Should you wear a mask? Should you not wear a mask? That we all went through 9 months ago when this whole thing started. And now maybe perhaps the controversy is, should you get a vaccine? Should you not? Should you get 2 doses? Should you only get 1? That controversy seems to keep getting stoked. Is there enough data that's out there that can help you with that? And how do you overcome some of those controversies?
Well, the first thing we have to take into account here is there is no certainty. And you have to give people the best available probabilistic data on vaccines, 1 to 2 doses, which vaccines have which side effects and how big of a population. But you have to continually take the data that's out there and be ready to respond to it and answer people's questions. And those who are most credible are going to be those closest to the person that's asking the question or that segment of the population. I think being able to respond quickly to the latest announcement by Dr. Fauci or the latest news story is critical. And recognizing that what we think we know today may not be true tomorrow is actually the most credible way to answer a question.
You said that there's been constant, that the news cycle is just 24/7 and there's always something new coming out. And you were talking about, obviously the new Johnson & Johnson vaccine and that being 1 dose and maybe having a lower effectiveness. And then also the rashes from the Moderna vaccines. There's always something that your team has to be responding to or prepping others to respond to.
What's most important here is not a big drum roll up to a big single definitive announcement, but a dynamic, resilient system where the data comes in, the messages get adapted, the channels get used, and we see how well they are working, and then make further tweaks to them. This is a very dynamic communication system that's going to work best if it's resilient and it changes as new data and new analytics come in, as opposed to the idea that we're going to get one definitive expert answer. It's not available today. The virus mutates, the messages have to mutate with the viruses, as do the channels.
Very strong. That's a really, really interesting. So I'm really curious to know, Mike, how do you get that data that the message is working? How do you know, for example, I'm resonating with it? Is there some feedback that the audience has to provide?
Well, you look at the data that's available in real time about what percentage of the population has been vaccinated relative to their percentage in the total population of a geography. You also look at what you're seeing online in random comments on any number of sites that are unstructured data sets. And you can get a feel for what's working and what is working less well. You can also talk to people, as I do, who run community health centers or who are part of major systems. All kinds of data is useful, and you have to put it into models and get it out there to see what is working and how well it's working.
What are the messages that you feel like when you see them out there, you're like, oh yeah, we're on the right path with that? And then what do you think, oh my gosh, we still have so much work to do to get that message out?
Well, I think the recognition that people who are peers and are trusted peers in a community are getting the vaccine and it's working well is a message that resonates everywhere. And it's a question of finding out who those individuals are, particularly if it's a Black physician or a Black nurse in a local area where you have a Zoom meeting where people can ask questions. That tends to work very, very well. Local is better. When you work with a CDC website and it's difficult for that data to load, or on its face, the system crashes, the logistics affect people's perception of competence. So if you have a system that crashes constantly or you're put on hold, even though that's more of an issue of the logistics of a system, it will spill over and affect people's confidence in the underlying messages or channels.
So Mike, are you using this data? I know you have the access to it and you're analyzing it and you're coming up with these amazing algorithms and customizing it to the population. But then are you informing the CDC that this is what they should do? Or are you somehow partnering with them? What is the mechanism by which all the other groups that are invested in communicating about this message are working with you? Or you just hope that they pick up from the education you're giving them about how to communicate the messaging?
We're in the process of launching a networking product within MakeUsWell, which should come out very shortly. And we want to go external with the analytics that we have put together. We wanted to make sure that we stress tested it internally before we went to external stakeholders, whether it's through media or through government authorities. We recognize that there are better known names, but we're coming out with a different model from many of the recognized authorities. When I look back a year ago to the news conferences of many of the governors, the challenge they had was they were working with static models that were very robust, but not very resilient. And it affected the credibility of those models. So we have spent a great deal of effort stress testing the resilience of our model before we go out public with it.
That's great. Anything else you'd like to add? The key takeaway, the number one thing that people should know right now when you're telling them in this forum what's important?
The number one message is there's no certainty, and it's because of the nature of the adversary we face, whether it's today's COVID-19 virus or tomorrow's pathogen or next season's influenza virus. The best lesson is that we have to continually monitor health indicators, the path of a virus or a bacterial infection, and we need to recognize that we have to adapt to the world we see, not assume there's a one-time message where one size fits all. And if we can internalize the idea that we have to continually manage our health in partnership with the authorities and with people we trust and with our peers, then we're going to all be a lot better off, not just with this virus, but with everything else that's going to follow it.
Well, thank you so much for being on. I really appreciated hearing about all of the new insights that you have. It really is fascinating. And we will certainly be talking to you soon because I love hearing the latest from you. So
Thank you
thanks
very
for
much
being here.
yeah,
And
thank you
thanks for
for
watching.
inviting me in again. Thank
Of
you.
My
course.
pleasure. Thank you.
Thanks for watching. Bye-bye.
Bye.